This topic is osteoarthritis. Osteoarthritis, or OA, is the progressive degeneration of articular cartilage and formation of new bone spurs. Now, unlike in rheumatoid arthritis, or RA, OA has no inflammation and is localized without systemic effects. RA is going to affect the whole body, whereas OA is just going to affect specific joints. OA typically involves weight-bearing joints such as the hips and knees. It also generally involves overused small joints of the hands. Activities like knitting can cause OA. Risk factors for OA include obesity because excess body weight puts extra pressure on the weight-bearing joints. Prior joint injury, such as an ACL tear in the knee, is also a risk factor for OA. With injuries like this, the joint can become misaligned, placing inappropriate pressure in different places of the joint. Finally, advanced age is a risk factor for OA. Over time, cartilage begins to break down and can even wear away in the body. This can lead to bone-on-bone friction and cause a lot of pain and osteoarthritis. As you can see in our image here, broken or missing cartilage results in a narrowed joint space. In this narrow joint space, exposed bones can rub on one another. Bone spurs also form as the body attempts to compensate for missing cushion by creating its own. OA is characterized by joint pain and stiffness, and this gets worse as the day progresses, but improves with rest. When we contrast this with RA, we see that RA gets better as the day progresses, but is worsened with rest. Remember that OA is caused by the overuse of joints and the breaking down of the cartilage and the tissue in the joints. So it only makes sense that repetitive use throughout the day is going to cause more pain and more symptoms. In OA, there is typically little to no swelling. Swelling is really going to only occur when there's some sort of injury or there's drastic overuse to the site. We contrast this with RA, and we can see that in RA there is swelling all the time and often in many places in the body. Because bones are rubbing on one another, clients can have crepitus with movement, and this can sometimes even be heard audibly. Crepitus is an audible crackling sound that occurs when joints rub together, and clients may feel a grating sensation in affected joints. As I mentioned, the body forms bone spurs and enlarges the joints with nodes to try to compensate for lost tissue. You can see this in the image here. Remember that OA is going to primarily affect weight-bearing joints, so clients may have a modified gait or a limp to avoid putting pain on these weight-bearing joints. OA is diagnosed with X-ray. In X-ray, you can see bone enlargement and nodes. If the loss of cartilage is bad enough, sometimes on X-ray you can even see the bones touching one another. Finally, it's important to note that with OA, we're not going to have the same changes in laboratory values that we will with RA. In OA, there will be no rheumatoid factor present in the blood, and the ESR will be relatively unchanged. Remember that ESR, or erythrosedimentation rate, tells us that there's inflammation in the body. Remember that OA doesn't have much inflammation, so it's not going to cause our ESR to increase. With OA, management of acute swelling and pain is very important. NSAIDs are going to help decrease inflammation, as will rest and cold therapy such as ice packs. If clients have done something to cause swelling in the joints, we need to wait till it subsides and then we can apply moist heat. Moist heat will increase circulation to the area. Now, ideally, we want to prevent or reduce the number of acute pain episodes these clients are having, so long-term management is very important for clients with OA. Assistive devices like a cane and walker can help offload pressure from the weight-bearing joints like the knees and hips and onto the device. Clients can wear splints or braces in affected joints to help immobilize them and reduce use of them. Raised chairs and elevated toilet seats can be used in the home. If you think about going to the bathroom or even sitting in a chair, clients have to bend down a lot, and even when they stand up, this is going to put a lot of pressure on the hips and the knees. If we can reduce the amount clients are having to bend and having to move, we can lessen their symptoms. Clients should be encouraged to complete regular muscle strengthening exercises. If we can strengthen the muscles, we can take the load off of the joints a bit and put it onto the muscles, which will reduce pain and reduce the worsening of OA. Finally, if clients are obese, weight loss should be encouraged. Removing excess weight from the body is going to decrease the stress and pressure put on the weight-bearing joints and reduce clients' symptoms.